Good morning, students. Welcome to our PHE online class. Dear students, in our subject physical education, the third lesson is yoga and lifestyle. We are in third lesson, yoga and lifestyle. You know, children, due to digital lifestyle, due to digital lifestyle and reduce the physical exercises, it leads to increase in various lifestyle disorders. Already we discussed earlier in the starting of this lesson, so many lifestyle disorders are there, such as obesity, diabetes, asthma, hypertension, like this. One by one, two we had already discussed about obesity and diabetes. Today here in this period we discuss about asthma. Understand? So asthma, that is a disease of lungs in which the airways become blocked or narrowed, causing difficulty in breathing. Understand? So let us to describe very briefly. Understand? It is a disease of lungs in which the airways become blocked or narrowed, causing difficulty in breathing. That means in asthma, the airways also swell up and produce extra mucus. It usually generates coughing, wheezing, and whistling and shortness of breath. The coughing usually occurs at night as well as in the morning. The excess amount of mucus in the passage further narrows the airways because it is thick. Understand? So, asthma may be due to genetic factor. There are substances that causes allergies like irritates in the air, including smoke from cigarettes, from wood fires, from strong fumes, spray, perfumes, or scented soap, etc. Understand? Respiratory infection also, such as cold, flu, sore throat, and sinus infection. Exercising in cold air and some medications, such as, what are the medications? Beta blockers, aspirin, non-steroids, understand, and other uh, things. Asthma can be prevented as well as cured if the following actions are practiced regularly. So first of all, we must know about the symptoms of asthma. What are the symptoms? The first one is rapid breathing. Rapid breathing or shortness of breathing. In both the cases, that is the symptoms of asthma. Then next one is tightness in chest. Then blue lips and fingernails, tightness in neck muscles, choking sensation, difficulties in talking, anxiousness, severe wheezing. These are the symptoms of asthma. Understand? So, if we feel this type of problem, then we can say that we may be the sufferer of asthma patient. Understand? Then to discuss causes of asthma. What are the causes? The first cause is respiratory infection like common cold, flu, sore throat, etc. Second one is sinus. Third one is mental stress and anxiety. Fourth one is genetic factor. Next one is allergic like cotton, smoke, pollen dust, drugs, perfumes, animal hair, etc. Then air pollution, then tobacco smoke, then exercise, then cold air or change to the weather such as changes in temperature or humidity, or we can say at last strong emotions like anxiety, like laughter, like crying or stress, whatever it may be. So, these are the causes of asthma. Understand? So, how we prevent it or cure the asthma? With the help of asanas. Understand? So many asanas are prescribed. So, what are the asanas benefited to cure our asthma or prevent from asthma? Understand? Let us read. There are 7 asanas: Sukhasan, Chakrasan, Gomukhasan, Parvatasan, Bhujangasan, then Paschimottanasana, then Matsyasana. Understand? These are the asanas. If we do practice regularly, then we may cure our disease like asthma. Understand? So, let us to understand one by one. It is the posture of Sukhasana. Now, I will just explain the procedures how to do the Sukhasana and benefits and contradictions that is written, no need to explain it, only the procedure I will explain it. Understand? In Sukhasana, first sit down with legs straight in front of you. Understand? First of all, you sit down with legs straight in front of you. Then second one, bend your right leg and place the foot under the left thigh, and bend the left leg and place the foot under the right thigh. Understand? Here in this way you will bend your legs. Then third one is place your hands on the knee with palms facing downward. And next one is keep the head, neck and back straight. Always sit in a straight position. Then at last close your eyes and breathe normally. Here in this way you can perform or do Sukhasana. Understand? This is the procedures how to do Sukhasana. Okay, students? Then the benefits are given and contradictions are given. Each and everything point wise it is written, no need to explain it. Understand? You will learn it. Then come to Chakrasana. What are the procedures or points how the Chakrasana asana will be performed? Understand? First of all, lie on your back with your knees bent so that the feet are placed close to your buttocks. Understand? Then second one is place your palms near the shoulders so that the finger point towards the shoulders. Third one is inhale and press your palms firmly against the floor. Lift your entire body up. Understand? This is the third point. Fourth one is strengthen the arms and legs as much as possible. Push up the hips and the chest. Then release the postures and relax in Shavasana. Understand? Here in this way you will do Chakrasana. Understand? So next asana is Gomukhasana. The benefits and contradiction of Chakrasana is given. You will learn it and read it properly because point wise it is written the benefits and contradictions. Understand? Then Gomukhasana. Okay, Gomukhasana, this is the posture of Gomukhasana. How we will perform the Gomukhasana? First of all, the procedure, first point, sit down with legs straight in front of you. Sit down with legs straight in front of you. Second one is bend your left leg and place it under the right buttocks. Bend your left leg and place it under the right buttocks. Then next one, bend your right leg and place it over your left thigh. Bend your right legs and place it over your right thigh. Then next one, fold your left arm and place it behind your back. Fold your left arm and place it behind your back. The next one, stretch your right hand up, bend your elbow and bring it down to the center of the back. Palm facing towards, try to hold this finger. Understand? Again I repeat, stretch your right hand up, bend your elbow and bring it down to the center of the back, palm facing inwards, try to hold the fingers. Okay, here in this way you will perform or do Gomukhasana. Understand? Then the benefits of Gomukhasana and contradiction. It is written, you read it nicely. Understand? After Gomukhasana, next one is Parvatasana. Understand? So Parvatasana, you see the postures is here, Parvatasana, and what is the procedure, how we will perform the Parvatasana. First of all, sit in Padmasana. Understand? You know Padmasana? Sit in Padmasana. Then stretch your arms sideways and bring them over your head slowly. Stretch your arms sideways and bring them over your head slowly. After that, let your palms touch each other. Then stretch your hands well without bending your elbow. Understand? This is the procedure of Parvatasana. First you sit in the Padmasana position, then stretch your arms sideways and bring them over your head slowly. Then after that let your palms touch each other, then stretch your hands well without bending your elbows. This is the steps, or these are the steps to perform Parvatasana. Understand? So, then after we learn the benefits and contradictions, the benefits and contradictions are given, you learn it. Then after this, we just see the posture of Bhujangasana. Already we learn about Bhujangasana. Okay, the postures is given. Just I repeat how the Bhujangasana postures we will perform. Understand? The first one is lie down on your stomach. Keep your legs straight, close to each other so that the ankle touches the ground. First of all, lay down on your stomach. Keep your legs straight, close to each other. In that position, your ankle touches the ground. Then place your hands at the shoulder level. Place your hands at the shoulder level. Inhale and raise your head, chest and abdomen up to the floor with the help of hand. Understand? And arch your back as much as possible and look upward. Then bend your back as much as possible and look upward. Understand? Then exhale and bring your body down to the floor to the normal position. Here in this way you will do the Bhujangasana. First of all, lie down on your stomach. Keep your legs straight, close to each other, and then ankles touches to the ground. Then place your hands just beside your shoulders. Then inhale and raise your head, chest and abdomen off the floor. Then arch your back as much as possible and look upward. Understand? In this way you will do Bhujangasana. Understand? After Bhujangasana, just you see the benefits and contradictions of Bhujangasana that is written here. You will learn it. Understand? Then Paschimottanasana. What is the procedure of Paschimottanasana? First of all, sit on the ground with legs forward. Understand? Here is the posture of Paschimottanasana. Then I will explain about their procedures, how to do. Sit on the ground with legs forward. Then hold the toes and your feet with the fingers of both hands. Hold the toes of your feet with the fingers of both hands. Then breathe out slowly and try to touch the knees with your forehead. Understand? Breathe out slowly and try to touch the knees with your forehead. Understand? After the breath in slowly, raise your head upward and come to the prior position. Understand? After the breath in slowly, raise your head upward and come to the initial position. Here in this way you will do Paschimottanasana. Understand? Then the benefits of Paschimottanasana it is given and contradiction also given. Then jump over to last asana, that is Matsyasana. Understand? Matsyasana, how to perform the Matsyasana. So first of all, for performing this asana, sit in Padmasana, then lie down in supine position and make an arch behind. Understand? Hold your toes with the fingers of your hands. Then stay for some times in this position. Okay students, this is all about your Matsyasana, how to perform it. Once again, just I will explain about it. Sit with your leg straight in front of you. Sit with cross-legged position and feet on the opposite thighs like Padmasana. Understand? Or we can say, for performing this asana, sit in Padmasana position. Then lie down in supine position and make an arch behind. Then hold your toes with the fingers of your hands. Okay, then stay for some times in this position. Like this, we will do Matsyasan. Understand? Then the benefits and contradiction that is also given. You read it nicely. These are the 7 asanas given. I explain it, the procedure of 7 asanas one by one, and about the 7 asanas, the benefit and contradiction that is written here as a note. Understand? So, I hope you must learn it and to be benefited by doing this type of asanas or performing this type of asanas. Okay, students. So, this is all about your asthma. Understand? Asthma is one of a lifestyle disorder. Nowadays, due to our digital lifestyle, that means always we want to take the help of machinery things, bad fooding habits, and reduce the physical exercises. Our lifestyle disorder increases. What are the lifestyle disorder? That may be obesity, that may be diabetes, that may be asthma, that may be hypertension. Understand? Like this. So, already we discussed about obesity, asthma, and today we discuss about asthma. Already we discussed about obesity and diabetes, and today we discussed about asthma. Understand? In the coming days or next period, we will discuss about hypertension. Understand? So, this is all about your asthma. Thank you, students. Thank you very much.